Welcome, everybody. Can everybody hear me okay? I'm hoping. So thank you for those for coming, first of all. We really appreciate it. And I thank you for the people who have added the locations in your name. It's nice to see where everybody is from. I want to welcome you to the second event in our Sangha Speaker Series. This is called the Dharma and Coping with COVID-19. We wanted to tackle, topics that maybe weren't readily discussed. And so mental health seems like it's a topic that's on a lot of people's minds, but we've discovered that it's usually not discussed. And despite being members of the fastest growing population in America, Asian American Pacific Islanders are 3 times less likely than their white counterparts to seek and utilize mental health services. And this is the lowest number or lowest rate of any racial or ethnic group. So in our first event, we addressed racism, and which was obviously a timely topic and one that's seeping into this one as well. So one of the things that we, has come on our mind are the hate crimes that we've experienced and we've seen as a result of the COVID-19. And these hate crimes we felt have reinforced the trauma within our Asian American Pacific Islander community. One of the articles that I read, Dr. Gilbert G., professor in the Department of Community and Health Sciences at the UCLA Fielding School of Public Health, says that this fear has had profound effects on mental and physical health. People's reports of discrimination and unfair treatment have been linked to major depressive disorders, clinical anxiety disorders, and mood disorders. And it's just taken a pretty large toll overall on people's mental health. So given these circumstances, we thought it timely to have this session to better educate ourselves on what mental health is and if and how the Dharma can help us improve our mental health. So just the overall flow of tonight's event, Reverend Shibata will be giving her speech, and then after we will have a Q&A session we're looking at probably an hour for the speech and then a half an hour for the Q&A. And, we'll be flexible, but we have prepared some questions ahead of time. However, if you would like a question to be submitted, if you can send that to me in the chat box, you can direct it directly to me, and I will be kind of going through them. We will try and get to as many as we can. I can't guarantee that we'll get to all of them, and we will be screening them. So just, FYI, but we will definitely try and include as many as possible. So with that, I'm going to introduce our sensei, Reverend Kory, to please introduce Shibata Sensei. So, Kory Sensei.
Right. Thank you, Michelle. Michelle's wonderful, by the way. These are great things that we're being able to do with her leadership. But also, we have a wonderful and one of the hardest working ministers in BCA joining us tonight. We had Reverend Matt, who was one of my classmates at IBS, went to Tokudo and Kyoshi with me a couple months ago. And now we have the other part of my Kyoshi group. That's just the 3 of us here tonight. Reverend Candice Shibata. She served at Berkeley. She served at Lodi, and now she's at Stockton Buddhist Temple. No, not Lodi. Yeah, Lodi, right? I can't remember. Florin. Yeah. That's right. You stole the kusamas from us. Everyone from Venice know that she stole the kusamas from us. And we're very bitter about that.
We're very happy. I'm so sorry.
No, that's right. I'm so sorry. Florin and then Stockton. She's back to where she actually grew up at. So I know they're very happy to have her back at home. She served as Kyokucho, or the head minister for her district, right? I'm currently serving now. I mean, so how hard are they working? There's 2 ministers for Northern Cal district, her and Reverend Matt. But they're very lucky to have them both in their district. you guys got stuck with me. So without any further ado, you know, let's all give a very warm welcome to Reverend Candice Shibata. Thank you, Sensei, for joining us tonight.
Thank you, Sensei, for that very kind introduction. And I will have to express my appreciation to Reverend Kory, because we spent our time together studying at IBS, the Institute of Buddhist Studies, and also traveled to Japan for both our Tokuro and our Kyoshi. So we've been on this kind of journey together. And so it's been nice to be able to have this time to be able to now work as colleagues. And I did come maybe a few years ago to speak, I think, at the Ishini Kakushini service. So that was a lovely service, and of course, all before the pandemic. But before I jump into my my talk today, I wanted to start by maybe all having us join in Gassho to begin this session together. Namo Amida Butsu. Namo Amida Butsu. Namo Amida Butsu. Namandouts. 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 Okay, so I'm going to start my timer. I need a reminder, like stop, so that we can definitely have some participation from our Sangha. What I'd like to do is share my screen so that for those of you who might be visual learners as well as auditory learners, you could see some of the slides that I created as well. Okay, so again, it's my honor and pleasure to be with you today to kind of talk about what's going on with us in regards to our mental health and how the Buddha Dharma can help us maybe cope with some of those feelings or anxieties that we're experiencing now, and like it was mentioned, talk about you know, some of those traumas that we're experiencing during this time too. Okay, so in regards to the overview, what I'd like to share is just some background information, both professional and personal. Talk about mental health versus mental illness and kind of see those differences. Talk about how culture affects mental health concerns that arose from COVID-19, strategies to increase our mental health and wellness, and look at our mental health through the Buddha Dharma, and looking at maybe some of our challenges today as we look at Buddha as a doctor or maybe a therapist. Okay, so again, first I do want to just share my appreciation, because all of this wouldn't be possible without, of course, Venice Honganji Buddhist Temple, Reverend Kory, Michelle, Jerry, and Ron for all of your assistance too. And of course, I saw that there's a grant from the Southern District Buddhist Women's Association. And as Michelle was talking, it's so timely to be able to share our thoughts and feelings about what's going on in regards to your series that you have. So I know the first one was about racism with Reverend Matt Hamasaki, and of course, talking about mental health. And I think just being able to have seminars like this that really tackle and address some of the issues that we as a Sangha, and quite possibly we as Asian Americans, or just human beings in general, what we're experiencing during this very difficult time. So I can talk about my professional background just a little bit. So I did study psychology when I was an undergrad, and then I did go on to pursue a master's degree in counseling psychology. And I did have a short stint as a marriage and family therapist intern, but so many different conditions of my life allowed me to pursue the ministry. So I did leave my job as an intern therapist, and I moved myself and my belongings to Berkeley to pursue higher education in Buddhist studies. And as Kory Sensei mentioned, I'm now serving in my home district where I grew up. So it's been a pleasure being able to be at home and of course be with my friends and family, but also give back to this community where I grew up. So it's been a wonderful opportunity for me to, again, give back. So all that being said, even though I do have a background in mental health, I do want to say this disclaimer. So, although I obtained my education in counseling psychology and interned as a therapist, the hat that I'm currently wearing, even today as I give this presentation, is my ministerial hat. So I'm not claiming to be an expert in mental health or mental illness, but I'm sharing my own personal thoughts and views and experiences today with you. However, as a minister, I am responsible for being a mandated reporter of abuse, and I'm required to report concerns about abuse or imminent harm if somebody is claiming that they're wanting to hurt themselves or another person. So of course, with all of our sharing that I hope that we do today, later on, we keep this in mind. And of course, if you need any help or assistance or support, we're here to be able to provide that to you. Okay. So after my disclaimer, I wanted to give full disclosure as well. And so mental health and Buddhism are two passions in my life, or maybe I should say psychology and mental health. And I did want to be very honest that I too, even as a minister, right, we're human beings as well. I suffer from anxiety and sadness and loss and grief and depression, frustration, anger, all of those, a wide gamut of feelings. And I myself has suffered some losses of relationships, the loss of my mother when I was 25, and experienced a lot of depression and anxiety after my mom died, and still have maybe some residual trauma of her very sudden death. And to be quite honest, I checked in with a therapist when that happened, almost 18 years ago. And to this day, I still see a therapist once a week to be able to check in with somebody, a very neutral person in my life, to be able to still discuss that trauma of losing my mom, talk about everyday concerns and worries and anxieties that I have. And I tell you this because I hope that my self-disclosure helps to normalize today's discussion about mental health, and also allows us to create a very safe space for everybody today. Okay, and that's what I urge all of us to do, is to have respectful and safe conversations so that we can all kind of tap into our own mental health and talk about that freely and safely. Okay, so going on, I wanted to talk about mental health versus mental illness. And there are differences. And so I just wanted to briefly explore some of those with you today. Okay, so what is mental health? So mental health includes a wide variety of different things. It includes our emotional, psychological, and social well-being. It affects how we think, feel, and act. It also helps determine how we handle stress, relate to others, and make choices. Mental health is important at every stage of life, from childhood and adolescence through adulthood. And this definition came from mentalhealth.gov. Okay. So what are some factors that affect our mental health? Some of these are biological, such as genes or brain chemistry, life experiences, as I mentioned, like trauma or abuse, and a family history of mental health problems. So again, maybe some of these are genetic. And this was found on mentalhealth.org. So when we maybe think about ourselves, or when we think about a loved one, we might kind of be concerned about some of the behaviors they might be exhibiting. So mentalhealth.gov gave some early warning signs of a mental health issue. And I just wanted to share some of those with you today. So some of these include eating or sleeping too much or too little, pulling away from people and usual activities, having low or no energy, feeling numb or like nothing matters, having unexplained aches and pains, feeling helpless or hopeless, smoking, drinking, or using drugs more than usual, feeling unusually confused, forgetful, on edge, angry, upset, worried, or scared, yelling or fighting with friends and family, experiencing severe mood swings that cause problems in relationships, having persistent thoughts and memories you can't get out of your head, hearing voices or believing things that are not true, thinking of harming yourself or others, and an inability to perform daily tasks like taking care of the children or getting to work or school. So many of you might be thinking, or can be thinking, like if you have seen some of these exhibited by friends or family. And maybe some of you, like myself, are thinking, oh, I experienced that. I experienced this one too. What about this one? And to be quite honest, during different parts of my life, I could probably check off many of these things. Even aches and pains, not knowing where these came from. Especially, I suffer from a lot of headaches. And so I'm wondering, maybe those are from stress, maybe those are from anxiety. But I will admit, I have experienced some of these during my lifetime. So when we think about mental health and some of those signs, then we kind of think about, when is it a mental illness? And so the Mayo Clinic offers this in regards to mental illness. Mental illness, also called mental health disorders, refers to a wide range of mental health conditions, disorders that affect your mood, thinking, and behavior. Examples of mental illness include depression, anxiety disorders, schizophrenia, eating disorders, and addictive behaviors. Many people have mental health concerns from time to time, but a mental health concern becomes a mental illness when ongoing signs and symptoms cause frequent stress and affect your ability to function. A mental illness can make you miserable and can cause problems in your daily life, such as at school or work or in relationships. In most cases, symptoms can be managed with a combination of medications and talk therapy called psychotherapy. So again, in regards to some of my disclosure, I do want to break this stigma, especially surrounding Asians and mental health. So when I actually lost my mom, I went through a wide variety, and I think I might have shared this at the Ishini Kakushini service, and how that loss and my mom's death and loss really affected my life, and then ultimately allowed me to kind of see my path to the ministry. However, many times during, immediately after her passing, I was wondering if my life would get any better, and I was very anxious about the future, but also very depressed that she wasn't in my life anymore. And so at times I felt like I couldn't get out of bed, but I managed to still take a shower and get dressed and go to work. But there was still something like really missing in my life, an utter sadness that I just couldn't shake. And that's when I knew that I needed help, because every passing day got a little bit harder. And so that's when I sought the help of a therapist, a marriage and family therapist. And I felt like it was a good turning point in my life to be able to get that help that I needed so that I could function as a daughter to my father and as a sister, an aunt, a friend, although my life was dramatically changed. So what I wanted to do next was just get in touch with terminology in regards to mental health, and what we can do to be able to better understand mental health care. And so this video that I wanted to share with all of you is called Mental Health Terminology. And this video was from Psych Hub. And Psych Hub has a wide variety of different videos that talks freely and openly about mental health. And so I just wanted to share that this short video with you now. Oops.
My doctor said I should look into psychotherapy to help me with my difficulty dealing with stress. I'm not sure exactly what psychotherapy is. Sounds a bit intense.
I am so confused. I know I need help, but should I be looking for a psychologist or a psychiatrist?
I just wanted to understand what I was feeling. My emotions were up and down, and I knew something was off, but I didn't know who to talk to or what to say. Even though mental health is just as important as physical health, it's confusing and hard to talk about our mental health the way we might talk about our physical health. In my case, when I started experiencing symptoms of mental illness, I didn't know much about mental health, and I thought there was little I could do. Gradually, I began to talk with my family more openly about my symptoms. We realized I needed to reach out to a doctor, and we found a psychiatrist in my community. I spoke with him about my symptoms, and with time, I received a specific diagnosis. With encouragement and support from my family and friends, I started a treatment plan my psychiatrist developed and learned that hope and managing my mental health is possible. Learning more about mental health may help you talk more openly about your emotions and thoughts and help you get the care you or a friend or family member needs. You can start by understanding some basic words that we'll share with you in this video. To help with that, I've invited my psychiatrist, Dr. Chapman, to talk with us about 5 mental health words everyone should know. We will review the following definitions today: symptoms, diagnosis, psychiatrist, psychologist, and psychotherapy. Hi, Dr. Chapman. Thank you for giving me a few minutes of your day to answer some questions about mental health.
Sure thing. Mental or physical symptoms are experienced by an individual, and when they share this information, it gives us clues that they may have an illness. For example, feeling sad every now and then is typical, but what if you were sad almost all day, every day, for more than 2 weeks, and you didn't know why? Another possible example of a mental illness symptom would be a hallucination, which is when someone sees or hears things that aren't there.
You said symptoms can give us clues that point to a mental illness. How do you know which one?
That's where the term diagnosis comes into play. A diagnosis helps to identify which mental illness is likely causing a person's symptoms. There are many kinds of mental illness diagnoses. A mental health professional can look at a pattern of symptoms and identify the appropriate diagnosis. They may ask you to fill out a questionnaire to help describe your symptoms. A doctor may also run tests to rule out medical causes for some symptoms, like checking thyroid function. Unlike some other medical illnesses, there are no lab tests to determine if a person has a mental illness. Mental health professionals may use a manual called the Diagnostic and Statistical Manual of Mental Disorders, or DSM, to identify if a pattern of symptoms meets the criteria for a mental illness. Sometimes it takes a while for a mental health professional to determine a proper diagnosis by learning more about a person's symptoms over a period of time, and that's okay. Since having the right diagnosis helps identify potential treatment options, it's important to be patient while a mental health professional determines a proper diagnosis.
You mentioned mental health professionals. Are there different kinds? Also, could you tell us the difference between a psychiatrist and a psychologist? They sound like the same thing.
Yes, there are several different kinds of mental health professionals who help people with mental illness. Let's start with your question about the difference between a psychiatrist and a psychologist. They do sound the same, but there are some differences that people should be aware of. A psychiatrist, like me, is a doctor who went to medical school to earn a medical degree. We have specialized training in diagnosing and treating mental illness. We can prescribe medications to treat mental illness, and we are also trained to provide psychotherapy and other interventions. A psychologist also provides many services such as mental health testing, psychotherapy, or counseling, and has extensive training in these services. Psychologists have an advanced degree in psychology and many times work in partnership with the psychiatrist. In some states, psychologists with additional training can also prescribe mental health medications.
What are other kinds of mental health professionals?
Nurse practitioners, or NPs, and physician assistants, or PAs, may also assess, diagnose, prescribe medications, and treat individuals with mental illnesses. Therapists and counselors are mental health professionals with advanced degrees who are licensed by a state to provide therapy. You might hear people use the words licensed therapists, counselors, and clinical social workers to mean the same thing. The difference is usually in the specialization. Some of these mental health professionals have a graduate degree, while others may have focused their education on marriage and family or other issues. Requirements and responsibilities can vary by state. The important thing is that mental health professionals follow state and federal regulations to act in the best interest of people that seek their services.
You mentioned psychotherapy. What is that?
Psychotherapy, sometimes called talk therapy, is a way that mental health professionals work with men and women to help them learn to cope with and manage the symptoms of their mental illness. Mental health professionals such as social workers, psychologists, and psychiatrists like me use psychotherapy. Psychotherapy is a type of evidence-based practice. Evidence-based practices, or EBPs, are treatments and tools that are based on scientific research and clinical expertise. Mental health professionals are trained to understand EBPs and consider the unique needs of the person they are treating when working with that person to decide the best treatment plan.
This was very helpful. Thanks for your time today, Dr. Chapman.
Happy to help. This information goes a long way toward helping others understand more about mental health and is a first step in breaking stigma and giving hope to others.
Dr. Chapman is right. There is hope, and there are many treatment options available. For me, I thought there wasn't much I could do to manage my symptoms, but then I talked to a mental health professional, learned more about mental illness, and after some time, I found a treatment plan that works for me. Now I'm helping others learn more about mental health so they too can find the help they or their loved ones need.
Okay, so I hope that that video was helpful in understanding and advocating for mental health care, just in case you or your loved ones ever need to pursue any support. And again, I think if we learn more, then we can talk about mental health openly with each other, and also break the stigma of receiving mental health care. So one of the questions, or one of the topics that I heard that some of you were interested was culture and how that affects our mental health. And so I kind of was researching, and culture really does play a huge role in regards to our mental health, maybe the view of mental health, and getting care for mental health. And so this notes that if society's culture impacts a person's beliefs, norms, and values, culture can impact how we view certain ideas or behaviors. In the case of mental health, it can impact whether or not you seek help, what type of help you seek, and what support you have around you. So I just wanted to disclose even my personal experience with seeking mental health help when I was 20. And that was my first encounter of being interested in seeing a therapist. And I believe she was a marriage and family therapist. So at the time, my boyfriend, who I was with from 16 to 20, very significant person in my life, I felt I was blindsided when he broke up with me. And so I was very, very sad, very confused, and had a lot of feelings of hopelessness and confusion and loss and grief, and even some anger. And so I told my mom, and I'm Yonsei, fourth generation Japanese American, and I told my mother, I need to talk to somebody. I don't know what to do with my feelings. I feel very, very sad. And I think our culture, or at least maybe her view, or maybe her view of Japanese culture, affected the way in which she approached me about going to therapy. She said, well, why do you need to go to therapy? You can talk to me. And I said, I can talk to you, but you're so close to this situation, because she really, really liked my ex-boyfriend and treated him like a son, and cared deeply for him. And she said, just talk to me. It's okay. You don't need to talk to anybody else. And so I really think that maybe our culture and some of her values and beliefs about mental health was preventing her from really wanting me to bring this maybe problem or issue outside of our home. However, I did say, well, I really do need the help, and I advocated for myself at that young age, and she was then very supportive. And I think through my my conversation with her and being very open and honest about what I needed, advocated for my health and allowed me to kind of get through that difficult part of my life when I was 20 and eventually become friends with him later down the road. So I do have to thank my mom for allowing me to seek the help that I needed and her participation in getting that help through my insurance and of course contacting some therapists to meet my needs. So in that sense, I really do think that our Japanese culture, or at least within my own household, affected my pursuit of mental health care. Okay, so let's jump into really what we want to talk about today, and that's COVID-19. And I'm sure many of you have been experiencing a wide variety of different feelings regarding COVID-19. And just wanted to kind of touch on that today as well. Oops, I forgot these ones. Okay, before we get into that, let me just go over again these 4 ways in which culture can impact mental health. And so I did get this from mentalhealthfirstaid.org. So again, cultural stigma. Every culture has a different way of looking at mental health. For many, there's growing stigma around mental health, and mental health challenges are considered a weakness and something to hide. This can make it harder for those struggling to talk openly and ask for help. Okay. Number 2, understanding symptoms. Culture can influence how people describe and feel about their symptoms. It can affect whether someone chooses to recognize and talk about only physical symptoms, only emotional symptoms, or both. So again, even our culture may allow us to talk about maybe the physical ailments, like, oh, I have a headache or my stomach is upset, but might not talk about the emotional symptoms that we're going through, like fear or anger or anxiety. Community support. Cultural factors can determine how much support someone gets from their family and community when it comes to mental health. Because of existing stigma, minorities are sometimes left to find mental health treatment and support alone. And the last one, resources. When looking for mental health treatment, you want to talk to someone who understands your specific experiences and concerns. It can sometimes be difficult or time-consuming to find resources and treatment options that take into account specific culture factors and needs. And even for myself, now that I'm learning a little bit more too, in regards to being Japanese American and identifying with a therapist who understands or maybe experiences very similar kind of cultural issues or concerns about talking about mental health. So for me, I do really want to advocate for a therapist who understands what's like to be maybe female or a woman of color or all of these different things. So it's something that we can advocate for our own mental health. Okay, so here we go. As I mentioned, mental health concerns that arose from COVID-19. So this specific chart from Statista, it says that there was this widespread impact on mental health and took into account all of these different countries. And 8,259 people were polled from February to June 2020. So we were in the midst of the pandemic, and it goes to show people in the United States, 33% were experiencing some stress, anxiety, or sadness, and was finding it very difficult to cope alone during the pandemic. While only 10% of people from Norway were experiencing some of these issues. So, you know, I'm really curious to find out what was so different between these two countries that people in the United States were experiencing these high numbers of stress and anxiety. Okay, so some of these, and some of you might have experienced some of these or even different mental health concerns. But as we know, isolation and loneliness, we were forced to be shelter in place. Even our own family members who might have lived down the street or in the same town, we were keeping our distance from them, not being able to hug our parents, kiss your grandchildren, or play with them. So definitely isolation and loneliness. And unfortunately, as some of our temple members, our friends, and our families who were residing in maybe skilled nursing facilities or residential care facilities, they too were completely cut off from the rest of the world. We weren't able to visit them. Maybe they had limited resources with computers and Zoom. And so this was a population too who were probably already isolated and probably felt even more isolated because of the pandemic. Increased stress. And this may result from a wide variety of different concerns, like stress of job loss and not being able to pay the bills because of the industry maybe shutting down or restaurants closing or whatever it might be. And that was a major stressor for many folks. There was complicated grief. I probably have conducted at least 20 plus funerals within the last year amongst my 3 temples that I supervise. And there's probably 20 more still waiting to have a service because they've been waiting for the temple to reopen. However, there's an issue of complicated grief, of not being able to say goodbye to your loved one when they might have been in the hospital, or putting off this funeral or memorial service because of the inability to gather at the temple or in large groups. So complicated grief is going to be a major issue to probably look at for many of our family and our temple members. So worsening of chronic conditions. So some may be suffering from diabetes or cholesterol, other things like that. And that might be a major concern as well. Let's see. Some might be concerned with anxiety or depressive disorder. And these might be existing conditions that probably or may have gotten worse because of the pandemic. We might have difficulty sleeping or eating. I, on the other hand, had a concern with overeating and gaining pounds as we were probably all sheltering in place. And I'm sure many of you have heard the COVID-19 or the COVID-20 and just packing on the pounds too because of our lack of interaction, eating, and maybe it is something of a comfort for us to overeat. So there might be an increase in alcohol and substance abuse as well. If maybe an individual had an issue already with substance abuse, and maybe the pandemic has increased their stress, which increased their intake of alcohol or substances during this time. Okay, let's see. So I just wanted to, I think there was a concern or a question regarding ages and mental health concerns during this time of the pandemic. So young adults have experienced a number of pandemic-related consequences, such as the closure of schools and universities, loss of income, and all of these things might contribute to poor mental health. During the pandemic, a larger than average share of young adults between the ages of 18 and 24 report symptoms of anxiety or depressive disorder. And compared to all adults, young adults were more likely to report a substance abuse and suicidal thoughts. Prior to the pandemic, young adults were already at high risk of poor mental health and substance use disorder, though they may not have received any treatment. And so again, this might have gone up. So this is a major concern for our young adults and what they might be experiencing during this very difficult time. So women and mental health. This particular survey this is from the Census Bureau Household Pulse Survey, which is an ongoing survey created to capture data on health and economic impacts of the pandemic. So this is where this research is coming from. And so women in mental health. Research during the pandemic points to concerns around poor mental health and well-being for children and their parents, particularly mothers, as many were experiencing challenges or experiencing challenges still with school closures and the lack of childcare, and possibly even assisting them with their online learning. Women and children are more likely to report symptoms of anxiety and or depressive disorder than men with children, so 49 versus 40%. In general, both prior to and during the pandemic, women have reported higher rates of anxiety and depression compared to men. Okay, so here are some notes about our babies, children and mental health. Children may experience mental distress during the pandemic due to a disruption in their routines, loss of social contact, and stress in the household. Existing mental illness among adolescents may be exacerbated by the pandemic, and with many school closures, they don't have the same access to mental health services that they might have had when they were in school. Additionally, child abuse may be increasing during the pandemic. Child abuse-related emergency department, ED, visits dropped during COVID-19 during the outbreak. However, the severity of injuries among child abuse-related emergency department visits has increased and resulted in more hospitalizations. So definitely a concern for maybe some domestic violence in the home and children getting caught in all of that. Okay, so what do we do about all of these different feelings that we're experiencing during COVID? And what about some strategies dealing or coping with the pandemic? And so again, this is another video from Psych Hub, which I found interesting. And I believe the content is geared more towards our first line, or is it first line workers? And what they might be experiencing, our frontline workers, frontline workers. So let's take a moment to watch this short video about what we're experiencing and strategies of coping.
The current challenges brought about by COVID-19 for people all around the globe are unparalleled and have caused fear, anxiety, and uncertainty for so many of us. We are all going through this together, and it's important to understand that you're not alone in how you're feeling right now, and that there are practical, healthy ways to cope with these emotions. The COVID-19 pandemic has created unprecedented change and a need for a response from everyone around the globe. Many of us are worried about our loved ones and our livelihoods, and there is no one right way to cope with what we're experiencing. Remember, however you're feeling, there are others that feel the same. You are not alone. Here are a few voices of people struggling to cope during this time.
Some days I'm okay. I'm doing my best to adjust. But yesterday, I couldn't stop crying. This all just seems so unfair, and I feel so angry that this is happening to us. I'm struggling to care for my kids and work from home at the same time, and I'm worried about my parents' health. I watch the news and it just seems so hopeless. I don't know how to keep it together.
I feel so lost and sad. So much has changed. I used to have dinner every week with my family, but now I can't be in the same room with them. I really miss them.
I'm missing out on my prom and my graduation. I've literally been looking forward to these things my whole life, and I'm heartbroken.
With everything going on now, I just can't stop my thoughts. And physically, my chest hurts, and I can't breathe. I get nauseous thinking about what could happen to my family and my friends.
Before this happened, I used to worry all the time about getting sick. Now that worry has turned into absolute terror. My heart races every time I have to go to the store. What if I bring germs home with me? I can't stop washing my hands.
No matter how exhausted I am, my sleep is still terrible. I just keep picturing all the things that could possibly happen. Will I ever get a good night's sleep again?
I've been through so much already. I don't know how I'm going to deal with this too. My flashbacks are getting worse and worse.
Honestly, I feel like I'm more comfortable in times of crisis. I'm not sure why I don't feel as upset as everyone else does right now.
I don't know when or if everything is going to get back to normal. I feel like the weight of the world is on my shoulders. How many people are going to be affected? What does this mean for me and my family?
We've just heard some of the ways people are being affected by the COVID-19 situation. Here are some things that are helpful in building resilience during times of crisis and intense stress. There are a lot of things outside of our control right now, which can be scary. By focusing on the things we can control, we can refuel ourselves and become more grounded and able to focus and cope with all of the things we can't control. One of the most important actions within your control is to follow CDC guidelines to reduce your chance of being exposed or passing the virus on to others. Use social support. No one should go through this alone. There is absolutely no shame in talking about what you're going through with your friends and family, and it's important to be there for others too. Video chat and phone calls are a great way to stay connected. Prioritize self-care. Staying on a regular schedule, exercising, eating a healthy diet, keeping a sleep routine, and taking time to meditate or pray are all important, now more than ever. Be gentle with yourself. During times like this, you will have good days and bad days. Your emotions are most likely heightened at this time. Try not to compare your life to what you see on your friends' social media feeds. There is always more going on behind screens. Helping others can bring joy and gratification. Do what you can to help others, even if it's something as simple as lending an ear or making someone smile. Be kind to the people around you, especially the folks who are still out working, to ensure we all have what we need. If each day feels like an uphill battle, it may help to seek out professional support. To continue helping during this time of social distancing, many mental health providers are using telemental health in their practice. If you can't afford therapy or need to talk to someone right away, you can call the Suicide Prevention Lifeline 24 hours a day at 1-800-273-8255. You are not alone in how you are feeling. There are things you can do and resources you can use to cope during this challenging time. Check out our library for more videos to learn more about mental health, dealing with isolation, and ways to cope. We're all in this together.
Okay, so thanks for watching that little video with me. And again, some of those things that they touched on, about normalizing our feelings, but also things that we can kind of do to kind of help with this pandemic and what we're experiencing. So remember, we can look at what we can control, because there's so many different conditions that we can't control. But just think about what we can control in our own environment. Find social support, prioritize self-care, and whatever that looks like for you. Be gentle with yourself, find ways to help others, and maybe that means being kind to the people that are still out there working, and also seek out professional support if you do need that support. What I wanted to go on to is look at the Buddha Dharma and how we can utilize the Buddhist teachings and what we've learned at the temple to support us during this very difficult time. So the way in which I wanted to try to tackle that, since we're talking about COVID-19 and the medical industry and all of that, let's look at the Buddha as a doctor or psychologist or therapist. And so I wanted to kind of venture into this idea of the medical model of the Four Noble Truths. So when you go to a doctor, you probably have an ailment that's been bothering you. So you go to the doctor and you ask the doctor, well, what's wrong with me? Why am I sick? What will cure me? And what else do I need to do to get well or feel better or to get rid of this illness? So hopefully those are some of the questions that you do ask your doctor. And what we can do is look at the Four Noble Truths in this way. So when we ask, what's wrong with me? We can relate it to the first noble truth, that there is suffering, and suffering is common to everyone, okay? And I think that's something that we have to remember, and something that could really bind us together or bring us together during this time, that everybody is suffering in some way, shape, or form. We may not be suffering the same thing, but we're suffering some type of battle during this time. So the second question, why am I sick, can be likened to the second noble truth. There is a cause to suffering, like greed and anger and ignorance, right? Or we use the acronym GAS. So, oh, I suffer from gas, but it means you suffer from greed and anger and stupidity or ignorance, right? And we all do. Everybody suffers from gas. So what will cure me? When we go to the doctor, we ask the doctor, well, what can we do? What's going to cure me of this suffering? Well, we have to remember that there is a cessation to the suffering, that there is a possibility that we can be rid of this ailment. So, well, what do I have to do to get better? There is a path. So the fourth noble truth, there is a path. And this path is the Noble Eightfold Path, which we know with different terminology, whatever book you might be using, but it includes right view, intention, speech, action, livelihood, effort, mindfulness, and concentration, okay? And what I wanted to do was kind of take this medical model and again, use my own personal example. So I wanted to talk about my visit with Jerry and that I was suffering with great regret. So I was called by a chaplain, and he was working at a specific nursing facility where Jerry was being cared for. And he was in hospice care with a terminal illness. And he asked the chaplain to seek out a minister because he wanted to be reconnected to his Buddhist faith. So I went to visit Jerry at the facility he was residing at, and I got I got acquainted with him through our visits, and I even brought him the book Ocean by Dr. Kenneth Tanaka and Onenju that he could have. And so I learned that Jerry grew up in Stockton, California, and it turned out that Jerry attended the temple where my grandfather was serving as a minister. And Jerry even recalled services at the old temple location, and he even mentioned that he knew my parents. At times, it was difficult to understand him because he had suffered a stroke, which affected his speech. However, we still managed to have nice visits with each other and continued to get acquainted with one another. During my subsequent visits, we talked about Jerry's family, what he previously did for a living, and even the topic of death. I initially visited Jerry weekly, but when I went maybe the past 2 times, he was sleeping, so I didn't want to wake him. My schedule was getting pretty impacted. If you can imagine, I'm serving at 3 temples, and at the time I was scheduled to do many funeral services. So a few days passed, and it was going into the next week, and I was planning on visiting him within the next few days until I received a call from my temple member who knew that I was visiting him, and she also remembered Jerry as well. And unfortunately, she had told me that Jerry had died. And I was filled with great regret because I had put off seeing him, and I was maybe trying to assure myself, like, don't worry, you'll be able to see him once your schedule clears a little bit. And a few days later, I also received a phone call from the chaplain who initially connected me with Jerry. And he informed me of Jerry's passing as well. So as we talked, I had this deep sadness come over me. And I thought about Jerry and not keeping my word. And even right now, I feel like I'm getting a little choked up because I have deep regret that I didn't visit him before he passed away. And I think what saddens me the most is thinking that he died by himself. And I did want to see him before he died. So although I knew that Jerry was on hospice, he physically looked okay. And maybe that's why I didn't think that his death was imminent, even though I knew that he was on hospice care. And when I talked to Jerry, he said, "No, I'm not in pain." Although I can now recall how tired he would get, even mid-conversation, he would fall asleep. And so I was reminded of how cruel impermanence was and how unexpectedly it can strike. And so I think about Jerry and my experience with him, and I think about maybe how the Buddha would respond if I went to go see him as my therapist. So Shakyamuni Buddha knew that illness and death, it's a part of our life, and aging is a part of life. And he would talk about Jerry's suffering of life and death, his illness, but also my suffering of grief and loss of losing a Sangha member, but also that regret that I felt of not being able to see him before he passed away. So I believe it was my own ignorance too, my ignorance about impermanence, that caused this deep regret. And I knew that Jerry was terminal, and I was ignorant to the fact that he could pass away at any moment, and so could I. And however, there was this ease to my suffering, which was aided by the Noble Eightfold Path, which quite possibly it was right view and maybe right mindfulness that allowed me to see that yes, impermanence can strike at any time. And I do need to be mindful of that, that it could happen to myself or any one of us at any time, including Jerry. So, again, I hope that with my personal sharing of some of my experiences, it allows us to talk about mental health in a very open and safe fashion. But I do want to get into possibly some of the questions. And I don't know if were there any specific questions that came through already? I didn't see anything in the chat just yet, but I can't.
No, I haven't seen anything come through yet. So if anybody wants to send it to me directly, but so far, not that you aren't interesting and occasional, everything and you relatable, and the way that you're making this so personal is just mind-blowing and makes it so much more touching and will make it, at least for me, last in my mind that much more. So I really, really want to thank you.
Of course, thank you. And again, it's my pleasure to do that. And I appreciate it, Michelle. Thank you so much for your lovely comments. What I can do is maybe if anybody has any questions, or if you'd like to share any of your own thoughts and feelings, or maybe your own anxieties or fears during this time, maybe we could open it up in that fashion. But I did want to try to tackle some of those initial questions, Michelle, that you sent me. So I'll do that, and then I'll stop sharing because I did present or have something on my PowerPoint. Okay, so one of the questions that I received was, should mental health issues be addressed by the temple? And if so, how do we address those? And so personally, I think maybe what I can do is stop sharing this, and I'll come back to this. Personally, I think that mental health issues can be addressed by the temple or minister, or the temple minister. However, I'm only speaking from my own experiences as a marriage and family therapist intern and somebody who has taken the opportunity to take clinical pastoral education units to become a chaplain. So I personally have a comfort level of addressing mental health concerns with my members or members of the community. With that being said, I'm not sure if every minister feels comfortable or equipped to address mental health issues with their members, and that's okay. And of course, there's nothing wrong with ministers or temple members who are approached with mental health issues of maybe temple friends or Sangha members. We can definitely say, you know, this is beyond my scope of what I can do. However, I'm going to do everything that I can to support you and maybe what you need. So there's no harm in saying that, as long as we continue to support them in a fashion that we feel most comfortable with. As I mentioned before, as ministers, we're still mandated to report abuse or any harm to appropriate authorities like CPS or the police, to indicate that there is concern with maybe somebody harming themselves or harming another person. And so as a chaplain or pastoral care provider, we can help our temple members. So I'm speaking from my own experience. We can help members by addressing the feelings of another person and assisting them with attending to their own emotional wounds and getting down to those wounds so that we can assist them in cleaning and healing those wounds. So I know feelings, maybe not everybody feels comfortable talking about feelings, but this is what we do as chaplains. We do attend to these wounds of patients or temple members or even people who are incarcerated. So chaplains can serve in a wide variety of different arenas, including churches and temples. So we do this by utilizing various assessment tools, then utilizing that assessment to create interventions. And then we evaluate how these outcomes are of these interventions. And so one of these tools is called the FICA. And I just wanted to share that with you right now, just so that we can look at that really briefly. So the FICA is an acronym. And as a chaplain, I would use this not only with my temple members, but if, for example, if I volunteer in a hospital, I would utilize something like this. So the F stands for faith and belief. And so say, for example, if one of our attendees came to me and said, Sensei or Reverend Candice, I have severe anxiety about what's going on in the pandemic. And I've lost a few family members and friends have died. So I would utilize this assessment tool. And I would ask you, well, what are your beliefs that help cope with stress? And so we would talk about maybe what you've utilized in the past to help address some of the anxiety or grief and loss that you've had. And say, for example, if I went to a hospital and if a patient said, well, no, I'm not a part of any Sangha or any congregation. So then I would ask that person, well, what gives your life meaning? What do you do? Or what do you believe in that gives your life meaning? And so the I stands for importance. Well, how have your beliefs influenced you and how you take care of yourself, either through this illness or this sad time in your life? And C, well, are you part of a community? What is your community? And it doesn't even have to really include just your temple or your church community. Like, are you part of, say, for example, a running or walking group? Or maybe do you take cooking classes and you have friends at your cooking class or at school? So what community do you have to be able to provide support to you? Okay, and then the A stands for address and care. So as your minister or as your chaplain, how would you like me to address these issues in your healthcare? How do you want me to advocate for you? Or how do you want me to support you? So this very brief kind of tool allows me to get an idea of what you're needing, what kind of community support you have, what are your religious beliefs, and how can we utilize those beliefs in supporting you during this very difficult time. So Again, I think the temple can address some of your mental health concerns, but it does just depend and is contingent on your minister's comfort level and their ability to be able to support you or possibly find support for you as well. Okay, I'll go ahead and stop sharing. Let's see. Okay, starting to get some questions. Okay, so Michelle, do you want to kind of tap into some of those questions? I'm trying to keep an eye on time and be very mindful and respectful of everybody's time. I know it's getting late.
You're so considerate, but we're actually just at the, we started a little bit later, so we're almost at the hour point. So we have plenty of time for our questions. So
okay,
if you mind,
there goes my alarm. I'm sorry. Stop talking.
You're doing great. No, this is just so interesting. You're so open, and the first question is from one of the participants tonight. Her name is Deborah Hiramoto. So thank you very much for submitting your question. And she has a comment as well to thank you for being so brave to share your story. And her question is that she knows a man who lost his mother to complications of dementia. And this man was heartbroken because his mother was his purpose in life. And they were very close. And now he is very lonely and alone. And he even spoke of dying in order to be with her again. So she wanted to know, how do you separate identifying the need for psychological counseling with this profound grief and depression with religious counseling of recognizing impermanence, which I think is a really, really key question, because the Buddhistic belief and a lot of that is not just kind of like hang in there and this, suffering is normal, but it kind of allows us to internalize it and be like, oh, well, because suffering is normal, this is just the way it is, as opposed to, no, you need to get help. So I hope.
Mm-hmm. That's a great question. And something that I can really relate to, because there's something about moms. And I think when you lose a mom, it's just, as a child, it's very painful. And that was my same question. I felt so grief stricken, and I always referred to her as like my anchor. My mom was like my anchor. She was like my cheerleader and all of these different things. And when she died, I felt like a piece of me died with her too. And I had grown up Jodo Shinshu Buddhist. And so, right, we talk about impermanence every week probably at temple. And I don't think anything could have prepared me for my mom's death. And it was a very sudden death. One we didn't see coming at all. She suffered from a brain hemorrhage. And she was only 59. So there's so many different aspects of that was really, really painful, right? I just envisioned my mom living this long life, me having her for the rest of, my adulthood as well. And she was just gone. And I couldn't just recognize that it's impermanence. Everybody dies, right? I mean, it was just so hard for me to recognize this very basic but very important tenet in Buddhism, right? And so I think what we can do to support our friends or this particular man is meet him where he's at and just sit with that loss and grief and just let him know, I do hear you. Normalize his feelings that yes, you are experiencing a very, very difficult loss. However, if just in my own opinion, if he is talking about, well, I just want to die to be with her, that would of course set off red flags for me. I would want to make sure that this individual, that my friend, wasn't contemplating taking his or her own life to be with his mother. And that's where I think maybe the support of a licensed therapist would definitely help with that, or reaching out and making sure that he doesn't have suicidal ideation or a plan to carry that out. And that's when we as friends knowing that maybe this is beyond my scope of what I can do, what we can do to support them. You know, let me help you get the support that you need that is beyond what I can do. And so, you know, again, he may not be even at a point to understand, well, it's, you know, it's impermanence. We talk about it in Buddhism all the time. He's probably still in deep shock and grief, and not at that point where he's at acceptance that this is impermanence. So I don't know, was that Barbara? I don't know, Barbara, if I answered your question or gave you any support at all, but I think, you know, when he's talking about possibly wanting to die himself, then that again is a red flag for me. But, you know, again, I'm talking as a minister. I don't know, Barbara, if you're still on, if that was helpful or not, or if you have any follow-up concerns or questions.
It's Deborah, and yes, I think.
Oh, Deborah, excuse me, I'm sorry.
Oh, no. It's, I don't know how you are able to answer these questions on the fly so well. So again, you're using so much personal, you're connecting to us personally and allowing us, you know, insight, which makes it so much more astounding and touching. So we have from our RSVP site, Give Butter, we had a question that was submitted about how to recognize depression versus COVID fatigue versus dementia or other significant neurological symptoms. They said MD not concerned. I'm not quite sure what that means. So this is kind of a general question. And then again, if you gave us a lot of really great information from some of the different sites. So, you know, I bringing your disclaimer into effect here. We're not asking you to, you know, provide expert opinion, but to, you know, from your personal experience and then from the knowledge that you have, if there's anything that you can tell us to help guide us as far as recognizing one thing versus, you know, something. It seems like a lot of these questions are, how do you know when it gets really serious, right? How do you know when this is, what are the differences between some of these things?
Yeah, and I think, so is like depression or COVID fatigue or dementia or whatever it is. I think when we're talking, you know, specifically about some mental health concerns and COVID, and whether or not the doctor is concerned, I think when it's really affecting our ability to function, then that's when we should be really, really concerned. You know, again, just even taking from my own personal experience during this time, right? And I don't know if Reverend Kory is feeling this at all, but we've had to transition. Everybody's had to transition to an online life, from children to adults, ministers, everybody, Sangha members. And so there is this Zoom fatigue. It's real, right? I hope you're not experiencing it right now, listening to me talking about it. But, you know, I get it. It's tough. And everybody's online. I don't have any interaction or any feedback from anybody in person. And it gets very tiring. But I think, you know, when we talk about even anxiety and depression, from what I had shared earlier, I think when it really, really affects our ability to function and just everyday kind of functioning, like getting up out of bed, taking a shower, changing your clothes, eating, I think that's when for me, again, some red flags would be going off to maybe encourage somebody to get additional support, whether that's telemedicine, talking to a therapist, going into the doctor, whatever it is, to either get medication or, you know, talk therapy. Those definitely would be the biggest concerns for me. But again, I know that like Zoom fatigue and compassion fatigue, it's real stuff. And even that too might prevent us from even wanting to go to work. I get it. So I think, you know, again, we kind of have to gauge and see where we're at, or ask somebody for help to get the support that we need. But I think, again, if it's regarding your everyday functioning or affecting your everyday functioning, then that would be a red flag for me.
I think this, thank you. I think those are really, really helpful designations. Although I might argue sometimes it's hard to know when laziness is a contributing factor versus depression. But I think, like you said, there are ways to kind of distinguish the two. So I thank you. I believe this is another Give Butter question. It's hard to get up every day and be inspired to keep going, as every day is Groundhog Day. Thank you for the reference. You can't do much with COVID looming and bad air quality due to fires. So this person is asking how to break out of this ennui. And I appreciate the use of ennui.
Okay. How to get inspired. That's a good one. That's a good one. Because I'm sure many of us, just to kind of even normalize this, if you feel comfortable, how many of you are having a hard time even getting inspired to do some of your favorite things that you're passionate about? Like, I could definitely raise my hand. Yeah. And so even things that we know that are really things that, like being a minister, right? And maybe I shouldn't divulge all of this information, but I'm hoping that it normalizes that we feel the same. Like, how do I get inspired when I feel sad to write? How do I get inspired about writing a Dharma message when I feel anxious or when I feel depressed? And maybe that's the teacher, right? Maybe my anxiety is the teacher, or maybe that difficulty of not being inspired is the teacher. Like, maybe because we aren't inspired, it allows us to find something else that we're inspired about. Like, for example, I was finding it very difficult because all of the meetings that I was actually seeing people, like having the pleasure of seeing them, they were all related to funerals. And that made me very, very sad that I was seeing temple members because their family member had died. And so how can I, with all of this death and dying around me, find passion in something like a hobby? And so, surprisingly, I haven't done it yet, but I got really inspired just from Instagram. And now I want to flip old furniture. I want to try and get old furniture from, garage sales. I want to strip the paint. I want to paint them and either decorate my house or sell them. So it's so weird how that kind of came about, because I never had any passion about getting into something like that. So I think maybe it is just really taking that time and being gentle with yourself, and even saying, it's okay if you don't feel inspired today. Be gentle. Take that time that you need to rest. And I think there might be a stigma about that too. I might be going off on a tangent, but even just allowing us to have that time to take a rest is okay. I have to remind myself of that. It's cool if you take your days off. You should. And I think all of us should be able to take our days off and take that mental or physical break that we need. And especially when we don't feel inspired. But I think, again, on the flip side, it can be that moment of being in rest that can inspire us to find passion in what we are here to do. What is our purpose? And for me, that's helping others. So I was kind of all over the place, but I hope that helped for that individual who submitted that question.
I have one that might be, so this one wants to address depression and anxiety, especially anxiety attacks. I'm not sure if they're asking specifically about how Buddhism can, address this, or maybe both, or, just in general. But maybe if somebody wants to chat me or Jerry or Sensei Shibata directly to give more information. But if we can talk a little bit about depression and anxiety attacks.
Sure. what I can do, again, my disclaimer, I'm not a mental health professional, but or at least not now. Maybe in my previous life I tried to be, but I think they kind of go hand in hand, anxiety and depression, right? Depression, it correlates with what we're clinging to from the past, right? Anxiety is this wanting to control the future. And unfortunately, we can't do that. We have to let go of the past in some sense. I don't want to say we have to let go of our past family members, but understand that our clinging to that is causing our suffering. And our clinging to wanting to control the future, right? That's what anxiety is. Not being able to anticipate, not being able to control what's gonna happen, right? And that's why we're getting anxious. Or at least that's my interpretation of that. And so from the Buddhist point of view, right? It's this clinging to both the past and the future that's gonna cause us suffering. But I hear you. When you have an anxiety attack, those feelings are very real. All of those emotions, all of the sensations that you're feeling, it's very, very real. And so I do want to say that I'm not discounting anxiety attacks whatsoever. But I think what we can do to ground us is to be mindful of the moment and utilize our senses, utilize hearing, utilize our eyes, our nose, our touch, to be able to ground us in this very moment, to be mindful of this very moment. So say, for example, if I'm having an anxiety attack about public speaking for this seminar, what I can do is try to ground myself in this present moment. So for me, I have this really beautiful orchid in front of me, and just concentrate on that and be mindful of that. I'm using one of my senses. I'm using my eyes to ground me in this moment, to calm me down. And I'm not saying that it's a cure-all, but that is something that I've heard to try to tackle an anxiety attack. Utilize these senses, but also again relate depression and anxiety to our Buddhist tenets as well. So, again, I know that clinging and attachment, it's in our nature. We're human beings, right? And the Buddha and Shinran Shonin knew that we're human beings. We're going to experience these things like greed and anger and attachment and clinging. And I think if we acknowledge that, it really normalizes our condition as human beings and all of these different things that we're going to experience as well. So I hope that answered that individual's question. I'm not sure if it did, but I hope it did.
It was helpful for me. So I appreciate that. We have a really interesting question. Now, this is related to, this is from one of tonight's participants. And so they're very stressed with the prospect of reopening the temple to the public. And because understandably, there are going to be some adults who refuse to be vaccinated, but who want to attend services again. And conversely, there's temple members who won't return if they don't feel safe, because, of course, they don't want to bring anything home and risk their loved ones. So this is a very practical question, and how can we accommodate both of these groups if both of them wish to come back to the temple? Would you advocate for separate services, outdoor services, individual visitations, with CDC guidelines on one hand, and then psychological safety, assurances on the other hand?
Sure. And so maybe if this person can maybe clarify with you, Michelle, I don't know if they want to come forward openly, but are they more concerned about how they feel at this present moment, or are they looking at direction of what I would recommend about reopening?
I think it seems more like temple direction, like overall. I don't think it's necessarily, or maybe if you feel comfortable talking about both, but just more direction on reopening.
Okay. Wow. I think
with a disclaimer, this can be, completely your opinion and completely, what you would recommend even for your own temple. We're not saying that we're going to post this in the Wheel of Dharma as this is, a new mandate.
Because Reverend Shibata said it was. Right.
Don't worry.
Yeah. Actually, so in regards to my temples, the 3 that I'm overseeing, they're very different in regards to size and makeup of Sangha members. So Stockton is one of my larger temples, and we're still taking a very conservative approach because we just don't want to take the risk. And of course, the variant is posing a different risk. And our members, we did have a wide and diverse membership from children to older adults, but the majority of our members are older. And so we are taking a conservative approach. And I'm okay with that. I'm totally okay with that. We do have a committee who kind of talks about all of these different circumstances that we're dealing with. And so as a group, we're coming to that conclusion to take a conservative approach. Still, we are opening up the office and the Nakotsudo, or the columbarium. And again, that's it. We talk about choice. So I think that was in one of the videos, that we have choice. Like, what can we control, right? To maybe minimize our anxiety about temples reopening or not reopening. So if I was an individual and I was very anxious about either coming into contact with people who were or were not vaccinated, or just coming into contact with folks, too many folks, we have choice in the matter, right? We can choose whether or not we want to attend. And so I think we can be our biggest advocate about what we feel most comfortable with in regards to temple reopening. Me as a minister, I have to advocate for the safety of all of my members, regardless of how small or how big my temples are. So yeah, 2 of my temples are taking a rather conservative approach. And maybe a few meetings ago, one of my other temples, because they were on the smaller side, we are looking at reopening in some sense. Maybe coming together for Shotsuki with all of these different precautions in place, because we have few members and a large enough space to kind of space everybody out. It might be a different story because we haven't met for the month of August, so maybe next month it might be different. But again, even if the temple decides we're opening up the doors, everybody has choice in this matter about how comfortable you feel. And I think you should advocate for your choice, and say, yeah, I'm going to stay home because I don't feel comfortable. So yeah, were there any follow-up questions or concerns regarding that matter?
Not for that particular question. Okay. We did get another one about someone who had a lot of their personal relationships suffering or ended due to the isolation of COVID, and they're finding it really hard to make the effort to reconnect. So is it okay to take more time, or do they need to push aside their own feelings in order to preserve these relationships?
Okay. And I think one of those things is maybe why did they kind of dissolve in the first place? And kind of just, was it just because we can't be able to see each other, or did we have different views about what's going on with COVID or racism, or whatever the circumstance, politics, whatever the circumstances are, and maybe kind of look at those and look at where we stand and where that other person stands as well. But I think if it is something that we wish to nurture, then again, we go back to choice, and being able to take that choice, being able to take those steps, and take that action to be able to do that. Because, again, I think we just have to be mindful of the situation that everybody is suffering in some sense right now. And there's no competition. I'm suffering more than you because of this, and this, and this. I think we can really be compassionate that everybody's suffering, and maybe it's, again, take that step and take that action of reaching out if that's the intention of trying to nurture this relationship that you had before. I don't know if I gave any Buddhist perspective on that answer, but I think even for myself too, it's been very hard to connect with family and friends. And I've just been feeling a little bit exhausted where I don't even have the emotional capacity to reach out to people. And I think everybody feels like that. Excuse me, but again, it's about choice and our ability to be able to take that action. Maybe it's right action, maybe it's right thought, maybe, I don't know if it's the Eightfold Path of being mindful of all of this and understanding that, yeah, we're all suffering right now. But somebody may ask too, well, why do I have to be the one to initiate that? And maybe that's just something that we have to kind of tackle with. Well, why do I have to be the one?
I think I want to go back a little bit to the cultural aspect of mental health. And we have a question from, I think from the Give Butter or from one of the participants about how mental health is a stigma in a lot of the Asian cultures. Mm-hmm. So how can we apply Buddhism and compassion and encourage the community to support those dealing with mental health issues and switch the narrative so it's not seen as taboo?
That's a good question. That's a really good question. I'm actually very curious, even just to kind of pull the room really quickly. And again, I do want to be mindful of everybody's time. How many of you have had not issues, but have experienced some type of stigma regarding mental health, or it might be ingrained in you about mental health? I'm really curious, even to kind of pull the room to see, like, what were some of the comments that you've received regarding mental health? And you can put them in the chat, like, even if you just want to put them in. I'm just really curious to see what you've heard. Like, I could start too. Mm-hmm. Go ahead, Michelle.
I think even in the questions that we sent you, the stigma of haji, right? The bringing shame on someone's family, and to overcome that, or to even sharing, your problems with somebody else, or your family's problems with somebody else, was very shameful. Mm-hmm. Or that, how dare you tell somebody else about your family's problems? It is that constant worry about, like, what will they think of our family? Well, what if somebody else finds out what's going on with our family? I think is one that I've recognized, whether it be personal or just just environmentally or within the people that I know.
Yeah. I mean, all of those were things that I was thinking about too. Like shame, or you don't air out your dirty laundry in public. You don't talk about your problems because it is going to cause shame. So I think maybe, again, even with my mom as an example, she didn't want me to even go to therapy with this very neutral person who was very trained in mental health, because maybe it just wasn't something that her family members did. I mean, and even to talk about it in your family, right? And I think maybe that's one of the steps of kind of battling this stigma about mental health is, I have to applaud all of you for coming to the seminar. Not that I was worried about the number, but even to just come to learn about mental health, to talk about it, to learn about mental health, I think is this a step in the right direction to being able to speak about your own mental health within your own families, to then maybe break that cultural stigma, and whether that means doing whatever you need to combat mental health problems or ease some of your suffering. So I think, again, even just coming here to be able to talk and learn and ask questions is one step in the right direction. because I think we have to normalize it. And talking about mental health and maybe your own suffering normalizes everybody else. Because I think it's so, for me, I think when I am able to kind of disclose maybe some things about myself, which in therapy, you can disclose some things, or as a chaplain, I can disclose some issues or some things that I've gone through, because then it opens that door of communication for other people to be able to talk about, like, well, yeah, Candice, I too had a breakup that was really hard, or I too lost my mom. And so I think, again, that just normalizes the suffering that we feel, and then it opens doors for communication. So I don't know if other people have other ways in which they've kind of broke that stigma, especially within Asian communities. If you have, please let us know. I think it'd be a wonderful resource, because I definitely don't have all the answers.
We're almost out of time, but I think maybe, is there a simple meditation tool or something that you would recommend to deal, that would help in dealing with anxiety?
Okay. You know, I was reading this book. Oh, you can't see it. When Things Fall Apart, Heart Advice for Difficult Times by Pema Chodron. So she's the really well-known author. I'll take this off so you can see it. Okay. And so she was talking about even meditation and utilizing, as I was mentioning, like, this moment is our teacher, or that person is our teacher. And so utilizing meditation to really tap into even our hopes, our fears and anxieties. And you know, one meditation that kind of comes to mind right now is just that metta meditation of, you know, may all beings be at peace and ease, and that also includes myself. So that's been one meditation that I think many. Oh, thanks, Jerry. Yeah, you're so fast. Yeah, so that's the book that I was kind of talking about. And chapter 3 is This Very Moment is the Perfect Teacher. And so she talks about utilizing meditation to kind of ease some of our anxieties. And if I can, just for a moment, there is a quick little verse in here that I highlighted. And she says, this very moment is the perfect teacher, and it's always with us. It's really a most profound instruction. Just seeing what's going on, that the teaching's right there. We can be with what's happening and not disassociate. And awakeness is found in our pleasure and our pain, our confusion and our wisdom, available in each moment of our weird, unfathomable, ordinary everyday lives. So I think, again, just being present, and if we are experiencing some type of anxiety, utilizing our senses, being mindful, being in the moment to be grounded. But also, if we're looking for a specific meditation, I'm thinking the metta or kindness meditation. And maybe that's something that we can share with everybody if you're interested. But I think it might be something that many of the Jodo Shinshu temples might have some type of copy of. Yeah.
I've asked Jerry to post the author. I couldn't type it fast enough. So if Jerry can type in the author to everyone so that we can all go run to Amazon or Romans or our favorite bookstore to pick that up. Oh, thank you.
Yes, thank you. Thank you. And I know Phil's had a comment too regarding the reopening. I may or may not be able to address that. I know that each temple has their own requirement that they're putting in place, and so some people may or may not require vaccination. Yeah.
Well, I want to be mindful of your time because you've been so generous with us. And thank you from the bottom of my heart that, I think tonight's been so interesting, so educational, and just it's really helped as far as, open the dialogue, right? Definitely started the dialogue. And I think this especially, though, should just maybe be considered a start, because I think this, there's a lot more that can be talked about, and a lot more that maybe even as a temple we can do to reach out to each other and, have more conversations and be allow people to express themselves more, right? And give themselves the opportunity to share. So, but I wanted to thank you for tonight and for everything that you shared with us. And I hope everybody enjoyed it. I think at the end of the last series, or the last talk, we sent everybody kind of a survey, right, to kind of get their feedback. So we're probably going to do the same, because we're trying to make each event even better and, learn from each event. So, but I'm just so grateful that all the preparation that you put into this, and all the personal touches that you gave, because it really, really helped. And I think everybody is saying how much they're thankful, to you. And so
thank you. Yeah, I appreciate everybody's attendance, and I'm seeing some messages and also some from direct messaging. So if I couldn't, what I'm going to do is put my email. So for those of you that would like to email me if I didn't get to your question, or if you have just a private question that you'd like to email me, please email me at my email address, and then I'll be happy to get to you. And yeah, and I think, again, I just want to really commend everybody for attending and being able to share your thoughts and feelings and questions. And again, not for my numbers, like I'm so happy to see so many faces, but I think, as Michelle was saying, it really allows this to be a start to talking about mental health in your own life, and maybe with your loved ones as well. So I hope it does start opening some doors for a conversation and breaking that stigma. Yeah.
And just so everybody knows, we will be posting this on, we'll be posting the whole YouTube video or whole video on YouTube. And I think we usually make the presentation shareable as well. I don't know if I don't want to speak out of turn, but we'll definitely make sure that the materials that, Sensei provided us will be accessible for everybody. So I'm going to throw this to Jerry, because I'm going to say thank you again for everything, but Jerry,
yeah.
out now.
Thanks, Michelle. Yeah, so I don't get scolded this time. For those of you who don't know me, I'm Jerry Iseda. I'm the temple president. Want to thank you all for joining us tonight. This is the second in our series. We have a group that we formed last year at the start of the pandemic called the Sangha Initiative, and it's our younger minded folks, younger adults, and folks with younger families. And a lot of these topics were inspired by things that they wanted to hear addressed. And so thank you all for joining us. Reverend Candice, thank you so much. That was terrific. You gave us a lot to think about. And, it's funny because I just went to the doctor myself. And as I was talking to the doctor, I realized I had been affected more by COVID than I even realized, by not doing things that we used to do. And you just don't even know that it's having a negative impact on you, and you keep trying. So thank you so much for making time to do this.
Of course.
Very special thanks to Michelle Orne, who has been our chairman and really has driven this whole event. And she put all the questions together. And of course to Reverend Kory for his guidance and input in helping us deliver this as well. So thank you very much. And then as Reverend Candice mentioned, thank you to the Southern District BWA, who was kind enough to give us a grant to help us put the Sangha series together. And so we will continue to have additional events like this. It's relatively new to our temple to tackle kind of some of these more current event type issues or timely issues, but it's important for all of us. So we'll keep you in the loop for the next one when it comes. So we hope you'll join us again. And just so everybody knows, we had a very nice reach, and thank you again for all attending. By my count, we had about 15 temples represented from all over the place. And so I know there's a lot of Zoom fatigue, but thanks to the advent of Zoom, we're able to do this and to reach so many. So thank you all for joining us again. And we hope to see you at one of our future events. And so with that, I think we're good. So Reverend Candice or Reverend Kory, would you like to just do Gassho as we close?
Sure.
Reverend Candice. Yeah.
Oh, okay. Okay.
Why don't you do that?
Reverend Kory, you okay? Okay, I'll go ahead and do it on our behalf. Please join me in Gassho. Namu Amida Butsu.
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 Namanda. Okay. Thanks everybody again for your attendance and your participation. And again, those of you who would like to message me directly, please do so.